Good morning, everyone, and thank you very much for the kind introduction, Maurice. And thank you all for your time and for joining this presentation, even if it's early morning for you and on a weekday. Some of you may know, but PANAVIA, the name of Kurare Noritake's cement series, is also the name of an aircraft. Is this the origin of the name for the PANAVIA family? Actually, it is not, but they do have something in common. Some aircrafts were a revolution and could break barriers, and the first PANAVIA did too. In 1983, the first PANAVIA, PANAVIA EX, was released. Back in the day, the retention of the restorations was mechanical, and thanks to the MDP monomer, the chemical retention became a reality. In fact, this was the very first product to include this legendary adhesive monomer. So this made possible to use type of materials and treatments that were not possible before. Actually, if we separate the word impossible, it says, I am possible. And this is exactly what the first PANAVIA did. Going back to the origin of the PANAVIA name, it comes from Greek and Latin. Pan means universal or all, and via means way. Hence, PANAVIA will mean the way for everything. In other words, the almighty adhesive. The first PANAVIA was just the start of the PANAVIA legend, and it kept evolving and adapting to the needs of the users. Now, let's have a look to the current situation of the indirect restoration. CAD/CAM systems have become quite popular. There are also changes in the materials that we are using nowadays. We have glass ceramics, zirconia, composite resin, and the aesthetic needs are also higher. Therefore, there was a need of a cement with high adhesion, not only to the tooth structure, but also to all these, let's say, new materials. And this is how PANAVIA V5 was conceived, a simple and aesthetic cement for all the indications. Nevertheless, in the dental practice, there are situations where we may want to consider porcelain veneer treatments. What are those situations? Well, the literature shows that we can group the indications of porcelain veneers into 3 groups. Type 1, when color is an issue. For example, severe tetracycline staining that is resistant to bleaching. Type 2, when the issue is the shape. For instance, conoid teeth or diastemas. And type 3 is related to pathologies like extended crown fractures. Plus, nowadays, patients care more about aesthetics and want to smile with confidence. Who doesn't like to smile, right? In fact, in Japan, now you can order free of charge a smile when you order food in some places. True story. Although we have excellent cements out there that can be used for cementing veneers like PANAVIA V5, when we speak of this treatment, it has specific features that we have to take into account. First is the restoration itself. It is thin and the paste consistency is crucial for an easy fitting. How easy to remove the excess cement is also essential. Number 2, normally, when we do this kind of treatment, several veneers are fitted at the same time. So what we want is to have a long working time and more control of the procedure. Number 3, this one is pretty obvious, but it should be an aesthetic cement that helps us to keep beautiful margins, since essentially this is an aesthetic treatment. So as we can see, there are specific needs for the veneer treatments. Now, let me introduce you PANAVIA Veneer LC, Kurare Noritake Dental's new cement specially designed for such specific needs. Let's have a look to its features. It has an excellent paste consistency, non-sticky, easy to seat the restoration, and easy to remove the excess cement. Next, excellent aesthetics, thin film thickness, aesthetic and smooth margins thanks to its polishability. And it also has a nice variety of shades. Then it is a PANAVIA, so high bond strength is expected and it does not disappoint. Moreover, it uses the same primers as PANAVIA V5, so the transition for those of you who are already using this product, it's gonna be pretty easy and smooth. Let's have a look to the components. We have clear filling ceramic primer plus that we will apply to the veneer. Then the K etchant, which is required as a pretreatment. We also have PANAVIA V5 tooth primer, which we will apply to the tooth surface, abutment. And finally, the cement itself that we will dispense. A couple of slides ago, I mentioned that PANAVIA LC veneer has an excellent consistency. But how was this achieved? So the secret sauce is the new filler technology. As you can see on the SEM image, we now have spherical fillers that will provide excellent polishability and gloss retention. We also have nanocluster fillers that will give us the nice handling. And we also have ytterbium trifluoride for the radiosity. So when we compare this to the other competitive products, regardless of the manufacturer, we can see that there is a huge difference. And this is very relevant clinically in terms of marginal integrity, polishability, and margin smoothness. As mentioned, this new filler technology will make possible to have this desired paste consistency, reducing drifting and sagging. It also has thixotropic properties, which helps a lot when seating the veneers. This is also a critical point, and we will see it later on a video. Are you ready to get technical? Let's move forward. In terms of surface roughness, we can see that PANAVIA Veneer LC has less surface roughness in the toothbrush wear test compared to competitors. In other words, it has superior margin smoothness. And this is related to its gloss retention, which we can see through the toothbrush wear. Even after 40,000 strokes, the gloss percentage barely decreased. How does it compare to other products? We can see on the graph that competitors start to lose their gloss pretty quickly and keep decreasing. As you know, these properties are also connected to staining resistance. Hence, to keep smooth margins contribute to keep aesthetic margins over time. And once again, this is possible thanks to the spherical fillers, which is, once again, very relevant clinically. Now, a PANAVIA product is synonym of high bond strength. How does this new product in the family of the PANAVIA series perform? Well, you can see that it performed at a similar level to V5. So now you know that you are in good hands. Equally, the bond strength to the prosthetic materials is excellent. Comparing to competitors, we can also see such high performance at the tooth level, but also at the prosthetic restoration level. So when all of us were at the dental university, they used to tell us that the prosthetics had to be mechanically retentive. But with veneers and this level of addition, we don't have to worry about that anymore. With these specs, we can definitely look at the competition without any fear. Since we are talking about technical data, here are more numbers when we compare to other products. Being honest, in terms of color stability, there is not a significant difference. But if you pay attention to the values in blue, we can see that this new cement has an advantage in critical features, such as gloss retention, as we saw earlier, lower film thickness, and also a longer working time. All of these are crucial for this type of treatment. Let's dig deeper. How does it work and what happens at the tooth interface? After pretreating the veneer with hydrofluoric acid in the case of silica-based ceramics or low-pressure sandblasting in case of zirconia, we have to apply the ceramic primer plus. Then you have to pretreat the tooth surface too, first with the orthophosphoric acid etching, and then with the tooth primer. So when applying the tooth primer and in contact with the veneer, PANAVIA Veneer LC paste, the adhesive interface will be sealed. However, you will still have enough time to sit and position your veneers. And this is because the final curing will be done by light. Okay, let's watch this animation. So the bonding interface will be sealed, as I said, but the actual setting of the paste will occur only when performing the final cure. So you are in full control of the whole procedure. Enough of technicalities. Let's go back to the clinics. How do we use it? Well, as they say, an image worth 1,000 words. So let's have a look to this video. So these are the three components: the primer for the prosthetics, the one for the tooth, and finally the cement. So before deciding which color you want to use, which shade, you can use the try-in paste, which are the same that the PANAVIA V5 one. Then you will treat the prosthetic restoration, hydrofluoric acid in the case of silica-based ceramics, and then clear field ceramic primer plus and dry. Of course, you will have to pre-treat the tooth and use phosphoric edge to the enamel. Rinse and dry. Okay, now we will apply the PANAVIA V5 tooth primer. Then we dry it. Okay, let me stop the video 1 second to comment about one very important factor that we have to take into account when we are cementing veneers: the bleeding. So we all know that after taking the temporary off, the gum will be prone to bleed. It has not been flossed or brushed properly for the last weeks, days, so it's a fact that it will be more prone to bleed. Actually, Dr. Joe Willerson, a key opinion leader in cosmetic dentistry, has mentioned that with PANAVIA V5 tooth primer, he does not get bleeding when applying the primer, whereas with other products that you need to rub the primer for a long time, you do get such bleeding. This is a huge advantage because, as you know, once the gum starts to bleed, you have to stop the bleeding, you have to re-etch, etc., and it takes a considerable amount of time. If this happens when cementing several veneers with every single tooth, well, you can imagine that you will lose a ton of precious time and you're going to be running behind. So once again, this is a huge advantage. Okay, let's continue watching the video. So after applying the tooth primer to the tooth surface, of course, you will dispense the cement in the veneer, and we will talk about this syringe later. Now you are ready to sit your veneer. Okay, time to remove the excess cement. You have two ways. You can tuck cure it for 1 second and remove the excess with a dental instrument, or you can just brush it and then light curing. Anyway, it's going to be very easy, and it's a key characteristic of this new product. And finally, you will perform the light cure. Of course, please remember that the intensity and the power of your unit depends, and please make sure to check the instruction for use for accurate timing. Okay, moving on to the shades. We will have 4 shades: clear, universal, white, and brown. As you saw on the video, you can also use the same trying paste that in PANAVIA V5. So the transition between these 2 cements is going to be very easy for previous users, as I mentioned earlier. In terms of the syringe design, it is actually the same syringe as our latest flowable composite resin, Clearfill Majesty ES Flow. However, the tip is not the same. It has been specially designed to make it easier to dispense, and actually the diameter is wider. Let's see how easy and accurate it is to dispense the cement compared to competitors. Please pay attention at how easy it is to extrude the cement, but at the same time, you will have a high precision when dispensing it, thanks to this specially designed tip. And this is something that it doesn't happen with other products. Now, the consistency and thixotropy properties of the paste make it so easy to handle and sit your veneers, as you can see on the video. Then finally, removing the excess cement is considerably easier than with competitors. And this is something that that you can see that I was struggling to remove the excess with other products. Some key opinion leaders already tried this product, PANAVIA Veneer LC, and we have some testimonials. So I'm just gonna quote Dr. Schmeding. PANAVIA Veneer LC is a joy to work with. The viscosity is perfect. Exceptional cement does everything that a cement should do, and very easily, predictably, and consistently. From Japan, also, Dr. Sato also mentioned that it has the ideal consistency, thixotropy, making it easier to sit the restoration. And I also mentioned earlier Dr. Willerson, who after practicing cosmetic dentistry and veneers for more than 20 years, he actually switched to this new product, PANAVIA LC Veneer. Let's have a look at some clinical cases. Here we have the picture before the veneers preparation. This is a very typical scenario where 6 veneers have been prepared from 13 to 23, from canine to canine. And here we have the results after the cementations of the veneers. In this case, actually, Katana Zirconia STML was used. Moving on to another clinical case, this patient wanted to improve the appearance of both of his lateral incisors, especially the right one, number 12. This is the preparation. Obviously, it was minimal. And this is after the cementation of in this case, 2 lithium disilicate veneers. We can see that the marginal lines are totally invisible and the cement behaves as it should. Okay, let's see this with perspective, right? Perspective is always very important. And when we look at the PANAVIA family, it could not be clear for you which one to use and which are the indications. So when we talk of PANAVIA SA Universal, we have to think of it as the daily cement to go for its simplicity and how easy it is to achieve consistent results. So the beauty of this cement is its single protocol without any primers. This is going to minimize errors during the practice and also make it ideal for CAD/CAM procedures since it bonds without any additional primer to zirconia, lithium disilicate, resin composite, metals, etc. So it is also going to be very easy to clean the excess cement. So for those of you that are still using glass ionomer cements or resin modified glass ionomer cements because it is easy to clean, now you can have a superior product, which is also very easy to clean. Nevertheless, its limitation is the veneer treatment. So this is the only treatment in this product, PANAVIA SA Universal, that is not included with its indications. So some of you may be already PANAVIA V5 users. So this is raising the bar, okay? So this is for those of you who seek even superior results from the bond strength point of view and also the aesthetics. And lastly, we have the product that we are presenting today, introducing PANAVIA Veneer LC. So this is going to complete Kurare Noritake Dental's portfolio, and it addresses the specific needs that veneer treatments have, providing this additional working time with light cure control and the ideal paste consistency. So why to switch? The bottom line and takeaways are: one, PANAVIA LC has the ideal consistency for this kind of treatments, thanks to the appropriate also thixotropy. It's going to help enormously when dispensing the paste, seating the restoration, and it is easy to clean up the excess cement. Two, it has a superior working time than the competition. Three, superior margin smoothness, gloss, and polish retention that is going to help to keep these aesthetic margins over time. Four, a lower film thickness, which is crucial that the veneers fit on the preps as they did during the trying, right? Fifth, so thanks to the touch cure mechanism, the bond interface will be sealed. And what does it make difference, clinically speaking? This sealing of the bond interface is going to provide a stronger bond and more durability. So actually, this is very relevant. And last but not least, the bond strength is going to be exceptional. After all, it's a PANAVIA product. To end my presentation, I like to share a quote, which I believe it summarizes pretty well Kurare Noritake Dental's philosophy and modus operandi. Try not. Do or do not. There is no try. So if there are Star Wars fans amongst you, you will know that this quote is from Master Yoda. Thank you very much for your kind attention. And right now, Maurice will open the session for some questions and you may have, and I will be more than happy to address them. Thank you very much.